Hi, everyone. I'm Jura. I'm facilitating this session. Hi, Dawn. Great to see you. It's nice to see so many people here. I'm just going to give it another minute while we wait for others to join. Hi, Fleur. It's great to see Fleur. Sorry. Fleur, do you think we should get started, or do you think people are still coming in?
Christina said that she was still admitting a few people as she figured out what breakout rooms I want to be in. So sure. I have, my time is Saskatchewan. I have 11:34. I'd give it maybe 1 minute.
Okay, sounds great. All right, I think we're going to get started just in the interest of time, because I do want to focus most of our time on discussion so that you're not hearing from me. And so, Fleur, correct me if I'm wrong, but I believe that we have an hour from now. Is that right?
Just looking at the schedule, I think they add an extra 5 minutes on. So I think we have 45 minutes.
Okay, 45 minutes.
45 minutes from now.
Perfect. Great. Okay. So I'm just going to very briefly introduce myself and provide you some food for thought on climate change and mental health, some perspectives. And I'm so excited to see so many people in this session. And I'm looking forward to hearing from you and talking more about, how mental health can contribute on the climate, in the climate space, and on discussions on climate change. So just to kind of review how I understand these breakout sessions work, again, feel free to jump in and let me know if I'm wrong. But basically, I think I'll spend the next sort of 5 to 7 minutes introducing, again, myself and the topic through a short presentation. Then we'll have a period of questions, which I think, will blend in really to the discussion, because I would really like to focus the discussion on your perspectives, on your thoughts on climate change and mental health and ways forward, and would really like to kind of motivate that. So without further ado, I'll introduce myself. My name is Jura Augustinavicius. I am by training a global mental health researcher, and my current role is as research faculty. I'm an assistant scientist in the Department of Mental Health at the Johns Hopkins Bloomberg School of Public Health, which is in Baltimore, Maryland, in the US. And you're probably wondering, what's a US researcher doing at a Canadian Public Health Summer Institute? But I am Canadian, and I live in Montreal. And so while I spent a fair bit of time away doing training, I have come back to Canada, and I'm looking forward to engaging more here. At the Bloomberg School of Public Health, I teach a graduate level, actually 2 graduate level courses now on climate change and mental health. I'm currently involved in developing a number of research projects in that area. I have 2 ongoing, one in Alaska and one in Baltimore with climate activists. And then I'm involved in a number of other international initiatives on climate activism and mental health. And probably the other reason that I'm here is I'm a contributing author on the mental health chapter on the Canadian Climate Change and Health Assessment. So that's a publication that's being led by Health Canada with scheduled release for 2021. You may hear about it elsewhere at the Summer Institute. So since I teach a course on climate change and mental health, I'll just provide a very brief sort of introduction to the topic. I'm not going to spend too much time kind of telling you the risks associated with global warming because I think that you've gotten a lot of that already. But, you know, based on the most recent Intergovernmental Panel on Climate Change report, or IPCC report, we know that there are very serious risks to, in a number of areas, including health, but also to livelihoods, food security, water supply, human security, and economic growth with warming of 1.5 degrees Celsius. And we already know that we are very rapidly, much faster than expected, approaching, if not, we've already approached that threshold. And so I'm not going to go into why 1.5 degrees Celsius is so important, other than to say that this has been seen, I guess, as sort of a political benchmark to kind of identify that beyond this point, the impacts on complex systems that sort of keep us alive and keep other systems on the planet alive are going to completely unravel. And even at 1.5 degrees Celsius, we're really in very big trouble. So it's kind of a balance between big trouble and absolute catastrophe. And so I encourage you to take a look at the 2018 special report that the IPCC released. There's a really nice summary for policymakers that I think is very digestible, and it really outlines a lot of the research and the work and the policy work that went into developing that various reports, but specifically around that 1.5 degrees Celsius benchmark. I'd also like to highlight that when we think about global warming, and this came up earlier in some of the sort of the introductory talks, one of the most important considerations is inequity and how global warming is actually increasing inequities that that already exist in our systems. And so this is just an example of a paper that actually measured that, and they found that increases were significantly related to poverty, disadvantage. So the gist is that on the current path that we're on, we will almost definitely reach 4 or 5 degrees Celsius in global average temperatures by the end of the century, which, you know, that's well surpassed catastrophic. So, so I just wanted to kind of motivate that. It's very depressing, so it's appropriate that now we're going to have a conversation about mental health. So in the climate change and mental health space, we really think about 3 sets of risks, which in public health we often call exposures, in terms of mental health outcomes. And so the first type of risk or exposure category is acute climate change exposure. So these are things like floods, wildfires, heat waves, tropical cyclones, which are hurricanes. In Canada, there are some, but not as many as in other parts of the world. But the important thing is that with these sorts of disasters caused by natural hazards, there's a lot of psychiatric epidemiological research showing increased levels of common mental health problems like anxiety, depression, and reactions to traumatic stressors. And we also see an exacerbation of pre-existing problems as well. There's also, and sorry, it seems like something has fallen off there. There's also been a noted increase in mental health related hospital admissions and visits to the emergency department. So, you know, that has 2 implications. One sort of points to severe mental illness and people needing support for things like, you know, support with medications that they may already be using, and how, for example, extreme heat actually interacts with those medications. But it also points to strain on the health system, at least in high-income countries where there are actually emergency rooms to go to, and where mental health support may or may not be provided. The second set of exposures or risks is slow creeping or chronic climate change exposures. So these things include rising temperatures, rising sea levels, melting sea ice. We are seeing a lot of this particularly in the Canadian North. And these are very, very serious threats to connection to place, to culture, and to, the social dynamics of many components of our society. And these things have been related to all sorts of mental health problems, but one of the ones that has been most eloquently described, I think, is ecological grief, and I'll define that in a moment. So that's just an example. And the third set of exposures are vicarious exposures. So this is the idea that just knowing that the climate crisis is occurring produces anxiety, even if you haven't been directly exposed by an acute exposure or slow creeping or chronic exposure yourself. So those are kind of just very quick framework for kind of understanding the literature on climate change and mental health. I'm going to very briefly go through some new definitions that have come up related to climate change and mental health. So ecological grief, which I mentioned and has been defined by a group of Canadian researchers that have worked with Inuit populations as the grief in relation to experienced or anticipated ecological losses, including the loss of species, ecosystems, and meaningful landscapes due to acute or chronic environmental change. Okay. The next idea is this idea of solastalgia or term. And this one's kind of interesting. It's a term that was developed by an Australian coined, I guess, by an Australian researcher that describes this, where nostalgia is feeling homesick for a place that you miss. Like, for example, if you were, had to migrate away from your home and you could not return, then you might feel nostalgic for your home. This is kind of the opposite. It's actually staying right where you are, but feeling homesick for a home that no longer exists in that context, right? So your environment is changing around you, and that's solastalgia. Eco-anxiety has received a lot of attention in mainstream media, but so far there actually hasn't been a ton of research on this. It has been defined though. So in an American Psychological Association report with Climate for Health and Eco-America, they defined eco-anxiety as watching the slow and seemingly irrevocable impacts of climate change unfold and worrying about the future for oneself, children, and later generations. And we've heard this kind of expressed by many youth activists, for example, that have been, you may have heard interviews in the media or heard these ideas. Of course, anyone can experience eco-anxiety. It's not just youth, but youth have been verbalizing it very eloquently. And then just a couple more. So these ones are a bit more positive. Psychosocial adaptation refers to measures that enhance or support the psychological and social health and well-being of people and communities so that people and communities can cope and thrive in a changing climate, increasing resilience to future impacts. And then finally, transformational resilience is a sort of a twist on a traditional definition of resilience. And so instead of this bouncing back to the state of things as they were, transformational resilience refers to this idea of bouncing forward from climate disruptions through a reckoning with socio-political conditions that shape our social, environment, and climate, that shape our social, environmental, and climate contexts, but are also shaped by injustices. So the idea is to move toward environmental health equity. All right, this is, just again, super briefly, I haven't talked much about mental health or psychosocial support interventions. I mentioned at the beginning that I'm a global mental health researcher. And so I work a lot in humanitarian settings. And this is one model for how we think about mental health and psychosocial support in humanitarian settings. And I think it actually applies very nicely to work on climate and mental health. And this is just to say that in that space, we see mental health and psychosocial supports along sort of this building on multiple levels. So at the basic level, we're thinking about how mental health can fit into other kinds of basic needs, supports, basic considerations in security and other things. So the idea is not to deliver some sort of very specialized thing, but just to kind of see how you can be thoughtful and considerate of people's mental health needs within the context of other kinds of services. The second layer really talks about strengthening existing community and family support. So how do you draw on what already exists in a community to support mental health and well-being? And examples provided here, for example, activating social networks, supporting traditional supports that are already existing that might be culturally relevant for people. The third layer is basic mental health care, and now we're talking about potentially in the healthcare system, so in primary healthcare or community-based care, but this is very basic sort of emotional support that might be provided by community health workers or family doctors. And then the very top is what you might actually imagine when you think about mental health support, which would be kind of specialized care like manualized interventions like cognitive behavioral therapy, medications, and so on and so forth. And these things are delivered typically by somebody who's well-trained in mental health according to, for example, psychiatric or psychological principles. All right, I'm just gonna close with a couple of thoughts. So I've given you kind of a rapid crash course on climate change and mental health, kind of Climate Change and Mental Health 101 in 5 minutes. And I just want to take a moment to share with you how I sort of personally became interested in this topic, because I'm not a sort of a climate change researcher by training. I'm a public mental health researcher. So years ago, I was working on a project in Bougainville, Papua New Guinea. This is a picture of one of the sites where we were working. And we were, Bougainville is a part of a series of islands in the South Pacific. And we were working in this area because some of the communities had experienced, or a large part of the community had experienced 10 years of conflict related to the operation of an Australian mine. And so we were there doing a mental health needs assessment to try to plan the implementation of services, and of course to also figure out how to actually assess mental health in a culturally appropriate way. And so through our research, my colleagues and I were repeatedly hearing about, horrific things that people were experiencing after the, during and after the conflict. So things like sexual and intimate partner violence, substance use, a variety of mental health problems, and so on and so forth. But day after day, one of the things that I couldn't help but notice was actually the level of the water. And you'll see in this picture even how far away homes are from the water level. And so I was really struck by this. And when I came back from doing that work, I had picked up a virus actually flying through Vancouver, which is applicable, I'm sure, to many of you, and was in bed for kind of 2 weeks. So started reading about climate and kind of went down this rabbit hole. And around the same time, Stephen Hawking had released someone had quoted him essentially about a documentary that he had released saying that we had 50 years to leave the planet. And this had a huge impact on me. I had a very, very strong emotional reaction to this. And it really kind of turned my life upside down. I think it was probably some sort of, association between this recent experience that I had had, which was very vivid and very impactful. And then, just kind of grappling with this very sort of existential piece of what was coming. And so, in many ways, because of my privilege as a white woman who's, been able to take advantage of many opportunities, I think I was able to actually draw on those resources that I had to kind of change things around. And so I started to incorporate climate change much more into my career. I changed, a lot of personal things that I was doing. But for me, it was kind of a happy ending that came from a very dark place. And I don't know that that's, in fact, I know that that's actually not true for everyone, but I just wanted to kind of share that experience with you to kind of provoke where I'm coming from. And I also wanted, we hear a lot of negative things about climate change. And I certainly spend a lot of time focused on data and other aspects that are extremely negative. But I did want to share with you this excerpt from Drawdown, which are the top 100 solutions to, it's called the most comprehensive plan ever proposed to reverse global warming. And they've sort of scientifically itemized or indexed from 1 to 100, the top 100 solutions to mitigate and adapt to climate change. So Paul Hawken in the introduction says, we can be tempted to believe that global warming is something that is happening to us, that we are victims of a fate that was determined by actions that precede us. If we change the preposition and consider that global warming is happening for us, an atmospheric transformation that inspires us to change and reimagine everything we make and do, we begin to live in a different world. We take 100% responsibility and stop blaming others. We see global warming not as an inevitability, but as an invitation to build, innovate, and affect change, a pathway that awakens creativity, compassion, and genius. This is not a liberal agenda, nor is it a conservative one. This is the human agenda. And so for me, what this brought up, this is the climate march that I had the privilege of participating in Montreal earlier this year. For me, what this brought up is a reckoning with a lot of the systems that I've been a part of and the injustices that I have, been absolutely a part of perpetuating throughout my life, knowingly or unknowingly. It's irrelevant. But really, this discomfort that arose from that, and this discomfort around the fragility, but also now I feel this tremendous excitement for what can be done and for what we could create together. And I think that mental health is a huge part of that. So I'm going to leave you with that, and I'd love to kind of turn the floor over to you and start the discussion.
So Jura, I think you need to stop screen sharing. Oh, looks like you have, because maybe I'll
Yes.
pop up the Word document now, because I think what happens now is that we kind of discuss about what are some of the key implications for public health action around around mental health.
Yep, and I've actually developed, I'd love to hear your feedback on that overall discussion comment, but I've also developed some kind of other questions if you're interested. Fleur, I don't know if we should start with the general one or if we should go into the others.
However you think is best.
Okay, all right, so maybe we'll just dig into those. So I wanted to start with, and I know not everyone in the room is probably a mental health person, and that's totally fine. But what do you think that, how can mental health work and public health work in particular contribute to climate change adaptation and mitigation? What are your thoughts? Is there a role, or does that sound really far-fetched to you? Anyone want to speak? If you want to speak, just unmute yourself and speak. And if we have multiple people, we'll ask you to raise your hand. Anyone? Dawn, you want to speak? Go ahead. Oh, I think you're muted. Let me, can you just unmute yourself on the bottom left? Did that work?
Yeah, Donald, it looks like your audio's not working. I wonder if you want to just put it in the chat.
Yeah. While he's doing that, does anybody else want to speak? You can also raise your, I don't know if you know, oh, can you raise your hand? Yeah, or just unmute yourselves and speak. So just to repeat the kind of the prompt, what role does mental health essentially have in climate adaptation, if any? Or is that a strange link to make? Curious to hear what you guys think.
I'll talk. I'm Jillian, and I'm from Houston, BC, and I'm a mental health and addictions clinician. So I think that it does have a huge role, and it's something that we see as being like a logging industry kind of community, that it is something that really does sit with people as they are aware of climate change and some of the issues that they're helping to perpetuate in their occupations. And there's a crisis that goes on for a lot of clients that I've had in the mills and in the logging, that they they are understanding they're a piece of that, and there's some harm and some anxiety and depression that comes with that, as well as in some of our people that work in, fisheries and work in hatcheries and those kinds of things, and trying to feel like, they don't have much ability to make change. So I really appreciate your breakdown of the different ways that mental health plays out with climate change, because it's something that I definitely see in the work that I do.
Yeah, and that's actually not something that, at least on the research side, that we've looked at a lot in terms of sort of occupational hazards have been examined in terms of, for example, like outdoor workers who are exposed to some of the environmental hazards that I mentioned. So extreme heat, for example. But we haven't really assessed occupational hazard in the sense of, linking what you're doing to climate destruction. And I think that's really, really interesting. So, Jillian, I might push you a little bit. How could our social and, governance and political systems support clients that you have who are, concerned about these things in relation to what they do better? What do you think, what do you think would improve their mental health if outside of seeing you, which I'm sure does.
But I think that, what you've alluded to in taking your own personal responsibility and finding ways that you can be able to reduce your, carbon footprint, be able to reduce the impact that you're having is one way. But I wonder too. That's why I'm asking the question. Like, I don't really know how to best support from like a microtherapeutic kind of standpoint.
Yeah, that's great. And so I'm going to open it up to everyone else, but I will just say, to clarify kind of my pushback on that, there is a tension between individual action and higher level action. And that really comes to a head in many spaces on climate and health, but in particular with mental health, because mental health, as we know, has, obviously all aspects of health are individually experienced, but also experienced by communities and at other levels. But mental health in particular has really evolved out of this kind of like psychological kind of industry, this area that really prioritizes the individual over everything else. And that is very incongruent with a lot of the other ways of thinking and being that we've been hearing about today in the summer course. But what that also means is that, I would push back and say that individual action will help, because engaging on things that you care about has been shown to be good for your mental health. So for example, if you experienced a disaster and you engage in kind of building back your community, you work together with neighbors and with friends to do that, that can actually be, it can serve a sort of a restorative purpose. But really what is required are higher level solutions. And so I think the complexity here is thinking about how to link individual mental health and community level mental health with pushing some of that higher level change. And that's hard. So curious to hear if anyone else has thoughts. I don't want to speak. And Don said, given the occurrence of the pandemic, the response has shown that major government, NGO, and citizens have the capacity to take on what is needed and what has been learned that could be used to have an impact on mental health. Don, that's an excellent point. And actually another one of my little discussion probes was on how, lessons that we've learned from the pandemic. I will kind of challenge you with this one thought, I guess, or not challenge you, but just give you some food for thought, which is that, we get directives from public health authorities and from our governments. And so, for example, Theresa Tam or the Prime Minister will get up and say everyone should be wearing a mask if you're indoors, or everybody should be maintaining 2 meters of distance from people in relation to COVID-19, and so on and so forth. And those directives are actually carried out by individual people. And so again, just getting back to that complex linking, the work of, for example, infectious disease control or the work of climate adaptation is actually done by people, but it's defined at other levels. So it's kind of overcoming that gap. And I just wanted to frame that in a different way. Sandra says, yes, personally giving back, finding some balance in our daily lives. That's a great point. And working towards more sustainable resource development in each watershed. Yep. Yeah, I think those are all really good points. So, you know, finding ways ourselves to take care of ourselves, self-care is definitely really important in terms of finding balance. And you know, I think the general idea here is that when people are experiencing higher levels of well-being and they are experiencing better mental health, then they're better able to engage on these issues. I'm curious if from a health systems perspective, anyone has any thoughts. Like, yeah, is Monica
Yeah, I think somebody had their hand up. Monica or Monique?
or Maureen?
Maureen, that's it.
Yeah, Maureen,
Yeah.
do you want to
Yeah.
yourself? Yeah, go ahead.
I'd like to comment on that. One of the things that I think is going to be really important is not having silos around this, like mental health being over here and public health being over there, or health promotion being over here. Like there has to be a conversation and a moving forward together as opposed to separate. The second thing is that what I've noticed in terms of our dealing with this COVID in British Columbia is having a really respected person doing the dialogue, and it's not so politically oriented. So like with Dr. Bonnie Henry coming forward and Adrian Dix from the Ministry of Health coming forward in a scientific, this is what we're doing, and giving an update to the population. I think that that's really important. I am concerned about children and youth in terms of climate change and the Anthropocene because they're not in school, so there's not that stabilizing effect of the teachers. There's really crazy stuff happening in terms of the news, particularly come from the States. So in terms of mental health in the future, I think we have to look at how we're going to be assisting children to understand what's going on and be change advocates, which I think some of the protests are reflecting. So those are my points of view. Thank you.
Thanks, Maureen. That was great. Yeah, and completely agree. I was actually on a call earlier today with colleagues, and we were talking about really this tremendous role that advocates and activists, youth activists in particular, have taken on in defining the future. And in many ways, it's an unprecedented role in recent history. So it's a burden, and I think adults in particular have a huge responsibility to support youth as they're developing in that context. But again, I'll say, and there's not a ton of research here. So, you know, as a researcher, I always feel a little uncomfortable talking about topics that are not evidence, you know, super evidence informed. But for example, one of the studies that I mentioned earlier that I'm leading right now in Baltimore is with the Baltimore People's Climate Movement, and we're working with youth activists to understand mental health concerns and better support those concerns among activists. And I think really our hypotheses, at least for that study, are kind of twofold. On the one hand, we know that particularly in the context of, you know, U.S. politics, but arguably here as well, there's, you know, activists are pushing for something that is not being well received by the federal administration, and that's really hard. And there are a lot of mental health implications of that when you're fighting for something and you feel like your voice is not being heard and it's not being acknowledged. On the other hand, as I said earlier, engaging on an issue in a positive way, you know, in a nonviolent, proactive way, in a way that increases social ties and connections, can actually potentially be very mentally healthy for you. And so those are two things that we're going to be exploring through that study. So anyways, just wanted to take on your points. And then the other thing you said, Maureen, that I think is really important is this idea of sort of intersectoral collaboration and cooperation. And I think some, you know, not to call out some sort of mental health disciplines, but some disciplines do it much better than others. So for example, social work is a really nice example where, you know, by training, social workers are much I think more inclined to think about these ideas of social justice and how to work collaboratively with other health professionals. But I would challenge and say that I think, especially for those of us in health and mental health, we need to really even go beyond that and start working in sectors that we might have thought, you know, like that 10 years ago would have seen as completely radical to engage with, like renewable energy as an example, or sustainable agriculture, and actually thinking about how to embed programming within those things. So how do you, for example, support livelihoods and transitions to other sectors like renewable energy and agriculture and improve mental health? And the more I've been working in this space, the less sort of radical and difficult that idea sounds. So yeah, and so just a few more comments. This is great. So Bernadette says, First Nations are increasingly turning to on-the-land healing and preventive programs for mental health and addictions treatments. The importance of these must be recognized as a valid and effective model with adequate funding. Along with that requires the preservation of the land in order to enable these practices to continue. Absolutely, Bernadette, I completely agree. And, you know, and this is an example of where we see a bidirectional relationship, right? So a positive impact on human mental health and a positive impact, a positive environmental impact. And so those things certainly don't need to be incongruous. And I think there are many people who would argue that actually sort of Indigenous healing practices and other cultural healing practices should be integrated into sort of westernized mental health care much more to acknowledge, for example, the importance of our connections to one another, among other things. So yeah, thanks for that comment, Bernadette. Sam, yeah.
Oh, sorry.
No.
Julian, it's Diane Simons. And I was just thinking in terms of, because I too am a therapist, or was one, and I was thinking about intersectoral cooperation in a different kind of way to help improve mental health. And that would be if public health, mental health, governments could invite people who work in those mills and fish in those waters, if they could invite them to be a part of making things more sustainable, that would empower them, I think, to feel better about the fact that they're working in an industry that, at least it's not the oil sands, but they're not working in an industry that that is seen as, helpful to the earth. So, I think when you involve people in solutions, and public health is a good system for inviting community in to comment on things. And I think governments need to do more of that, not less.
And I think I totally agree, and thanks for commenting on that. And I think that something that's come up a lot of times when people do kind of have that invitation and the question around, like, how do we band together? How as a community do we address some of these concerns that don't just apply to one person? And there's a lot of fear because, this is kind of the bread and butter of the community. And when the community is not diverse in its economic portfolio, and it is very specific to, the mills and the logging kind of industry, that can be a struggle. People are afraid of painting a target on their back. But I was thinking, as we were having this discussion, about collaborating in areas that may not be traditionally sought out, and about reaching out to like the community forests and to the different groups in the community that they would never invite a social worker or a mental health professional, but that I see no reason why I would not be able to go and to be a part of that as a means of advocating and bringing mental health to their interests, so that we can begin to have that conversation both ways. So we can have advocacy going both ways and in both directions. So thanks for that.
Yeah, thank you.
This is Stephanie, and I am in Alberta, so I cringed a little bit with the oil sands comment, but I'm in central Alberta. So, and so just sort of thinking, I was going more to the farming aspect, because that's what a livelihood of a lot of our people are. And I know as some of those silos they're trying to bring them down, that they're working on the land, but then I'm seeing the mental health impacts of years and years and years of drought that has probably been brought on by climate change. And just in the last 4 days we've had like 6 tornadoes, and just lots of different changes. And so even the mental health of like a specific occupation, as you had mentioned, mine or loggers and that kind of thing. But here in Alberta with the farmers, and their tactic is, you know what, my grandpa's done, you know, we've done this for generations and we just got to suck it up. And so just that whole mental health, changing the way of thinking about things, and that we want to extend the invitation. I work in public health to these other groups. We also have to be aware that maybe we have to really be open to how we're going to be having a dialogue with them, because they may have just closed in on themselves. This is how we've always done it. We don't really want anybody. So we just have to be really mindful of that as well.
Absolutely. I think, Stephanie, thank you. Those are really important points. And my hope in general for this field and for all of us here today is that we can recognize just how critical it is that everyone's included in solutions, and that, you know, all voices are heard and incorporated, and that actually by enhancing those connections, even when they make us a little uncomfortable, that's probably what's going to get us through if we get through. So I think that's critical. And again, I really feel that these, you know, when we're thinking about solutions, we really have to get out of the box. And so I really liked what was said so far, for example, you know, engaging on advocacy with other things, but even thinking at multiple levels. So for example, you know, and this is not intended to be a political statement, but if there was like a government sort of stimulus package that supported transition out of a particular industry, that was coupled with very thoughtful participatory invitation and dialogue on how to do that, that was also coupled with, you know, mental health support and support for families as they go through that transition, the likelihood of success just continues to increase. You know, one-shot solutions tend not to work. So, you know, really thinking, you know, are we addressing people's basic needs? Okay. Are we addressing their health needs, and really kind of ensuring that when we're thinking about sort of the social, economic, environmental determinants of health, that those different things are playing an equal role. So we have, I think, just a few more minutes for comments if anyone wants to respond. And I also want to get to the ones in the chat. And then I think we have to synthesize, right? Is that right, Fleur?
Yeah, so we have 8 minutes and 24 seconds until we're all thrown back to the main room. And so we have to come up with like 3 to 5 points in this that then we are going to present and we have to choose someone that will present them as well. So we probably are at that point.
Okay. All right. So maybe we should start synthesizing. I would encourage everyone as you're going through to please read the comments in the chat, because there's some really good ones in there. And we haven't gotten to all of those. And if anyone in the chat who's commented wants to comment on priorities and synthesis moving forward, sort of 3 to 5 points on like, what are the take home messages from this session? Please do so. Everyone's welcome to comment. Any thoughts? How would you summarize today and what's next on climate change and mental health in Canada in particular?
Maybe I'll start, just because I typed all this, and as I was typing, I was sort of thinking about it, that really this reaching out to other sectors that we're not used to working in, and to people that work in sectors that are maybe feeling, I don't know, attacked or challenged because of the environmental impact of their sectors. I think that's a point that really came forward in terms of, you know, collaborative working together with people to find solutions.
Mm-hmm. Great. Fleur, can you summarize that in a nice,
and I
nice kind of...
Because I'm screen sharing, I can't see the chat, so I can't type it in chat. But
oh, okay.
Figure out a summary.
Yeah. Are you going to put the summary at the bottom of your notes?
I'll just, yeah, and then I have to paste it into a slide. And
okay,
then
perfect.
I share the slide in the next section. So maybe I'll.
Okay. Yeah, so maybe you brought up 2 points. So one is working with other sectors, you know, and really kind of getting out of our sectoral, you know, seeing our sectoral blind spots, but working with other sectors, thinking about creative solutions at multiple levels. And then the other one, I think, was this kind of broader idea of drawing on potentially, you know, diverse understandings of our world to emphasize and increase our connection. Those are my take homes. Yeah, so I'm just going to read through. Does anyone, if anyone else has, we can put in 3 more take home messages. And so these are going to be shared with the rest of the group. So flag them in the chat. There's some really great ideas though, in much nicer language than I've been using. So someone said, for example, how we can transition to a care economy that values caring work away from a neoliberal economy. That's absolutely true. COVID-19 has revealed the consequences of neglect of this economy. Someone else said, you mentioned the different health professionals' ability and capacity to address the wide scope of mental health work. And there's an opportunity to involve climate change aspects into pre-service training. As mental health is increasingly integrated into health students, more can be added in terms of mental health promotion skills and competencies, including climate change factors. Completely agree as per my courses. And we're actually also developing a climate psychiatry CME credit with folks at Mass General Hospital in Boston. So very soon this is, and I know that the Canadian Medical Association, I think, or sorry if I got that wrong, but there's a major medical body in Canada that's also thinking about incorporating these things. Two-eyed seeing, absolutely. So Bernadette said, I agree that the topic should be part of all allied health professionals' curriculum, but not only in university, can begin in elementary school. Absolutely. So actually, yes, let's include that, Fleur, as an component of education. Yeah.
Just one other comment. It's who is going to present this information to the general population, given that in Canada we're at $1 trillion in debt. So that's how is that going to be packaged as a message that is sustainable and people want to get on board with?
That's a really great point, Maureen. And because you're the second person that brought up messengers, I think you're the second person, it wasn't you before. That's another super important point for the take-home messages flow. So like trusted messengers conveying kind of information. And I think part of that too is really thinking through how the process of behavior change, right? How does that work at a population level? What's needed? And there's a lot of evidence saying that messaging and the messenger is critical piece to that. So very, very important. Don said, living in a small rural community, it become clear to me that climate change is a stress leading to suffering. And on the other side, getting out into nature, preserving trails, looking after the ocean can have a very positive effect on the individual and group mental health. I can say personally that, again, being privileged enough to have a garden, that's really what's gotten me through the pandemic. And so would totally agree about the healing effects of sort of green space on mental health. And that might be something to think about incorporating more into elementary and secondary school education. So exposure of kids to positive interactions with nature. Any other thoughts?
We are going to have to choose someone to present this as well, and we now have 2.5 minutes.
Okay, who wants to volunteer? Because I am not doing it. It's got to be someone else. Any volunteers? And ML, I'm not sure who that is, but somebody said public health systems can work with education systems. Absolutely. Yeah, and so that's that idea of integration across.
I'm not volunteering, I'm just saying a takeaway, but really just, I think my takeaway from this is the need to work, again, that first point, with other sectors, and whether that's public health engaging with education, or mental health stepping out of our silo and engaging with a lot of different other areas of expertise. And I think that, yeah, that's my key point away from this.
Absolutely. Yeah. Wonderful. Yeah, and we have the comment about education also. Don says, I think a woman should present our key points. Well, let's see which person is interested we need a volunteer. So somebody feeling brave, that's not me or Flo.
Yeah, and I guess because of where it will be the 4th presentation. So you'll have people that have gone ahead of you. I don't think it's going to be very stressful. This is a kind group.
Well, yeah. I guess I'll do it if nobody else wants to.
Thank you for volunteering, Jillian. That's wonderful. Yeah. So Jillian's going to be our brave presenter. I have to apologize because I may not be able to actually be there for the presentation, but I did just want to close by, in the last minute, just saying what a pleasure it was to be here and to share this time with all of you. Thank you so much for making this a priority in your days. And I hope you'll continue to do so. And I hope that this discussion has inspired you and maybe even given you some more concrete ideas of what could be done in the days and weeks and years to come. And this is certainly, learning is certainly the first step, as we all talked about earlier. So thank you so much. We have 35 seconds and then we're going to be booted out.
All right, thanks. Very dynamic session.